friends, we're here today to show you how to make a chemotherapy care kit for your loved ones or friends that you may know that are going through chemotherapy. This is my mother.
Hi.
Her name's Kim and she's a survivor, so what better person to use than your mother and a survivor to help you make a chemotherapy care kit. So, Mom, what kind of things will we be putting in our chemotherapy care kit?
Well, in my experience, when you're participating in chemotherapy, you sometimes don't feel well after you've had the chemo, not necessarily during the process. So what we're going to do is build a basket that has different items that make you feel more comfortable. And you can decide whether you want to use some of the items the day that you're having chemotherapy, when you're sitting in a chair with an IV, but you're there for a couple of hours, or whether you want to use these products sometime afterwards so that you'll feel better when you're feeling kind of sick after the treatment. I used to go in on a Tuesday and be really sick on Wednesday, so we're going to put things in that you can use anytime during that process, and you can decide after you get to see what's in there. Let's start with one of my favorite things to give someone that I love, which is a teddy bear. I mean, come on, who doesn't love a teddy bear? This one's dressed up in little pajamas. Perfect. And also, I should say that this particular basket is for women, but as we all know, there are men who go through cancer treatment as well, and we could always dress a bear as a male if we want to do that. The other thing that would be comfortable that you can use during treatment would be one of these small blankets. You know, everybody's got these days. You could either get a Snuggie or you could just get a small flannel one like this, because it's often really chilly in the treatment room. That much I remember. I've been blessed. It's been 5 years for me, but there are some things that you don't forget. And being cold in that room when you have an IV is one of those things. Magazines, always good. Might as well be proactive and give current ones instead of the ones that are 10 to 20 years old at the doctor's office, because you may actually feel like reading something when you're there. Another nice thing to have once you get home is just a soap that isn't too scented, because often during treatment, I know that for me, I actually had a kind of metallic taste in my mouth, and I just couldn't smell. Certain things made me really ill, and women who've been pregnant before or who've had a serious illness can often smell things, and they're just more sensitive to that sort of thing. And so this transparent soap, it happens to be Pears, but there are all sorts of brands that are similar to this. If it's unscented or has a mild, clean scent, maybe lemon, something like that, it's probably good. You won't have to worry too much about the person being irritated. I think that another useful thing could be a sleep mask. This one happens to be embossed with the words rest, but you can get sleep masks anywhere. Often you want to take a nap when you're sitting in the chair. You just get tired. And it would be good to be able to block out some of the light with this, or the person could use it at home. Another just comforting treatment could be to have a cream that, again, is not too highly scented, that the person could rub on their hands and relax, or you could massage their hands if you have that type of relationship. And that feels really nice to have somebody massage your hands. And then just some cloth gloves. The cloth gloves would be nice to put over your hands and sort of let the cream settle in, and that makes the person feel really good. That goes along with the nap work. Again, they could use that at home. And then I happen to have some lip gloss here lip gloss could be good because you do get kind of dehydrated. Even though they're putting liquid through you, it's medicine. And this will help you to have soft lips. This one happens to be a white tea antioxidant lip gloss, but you could pick any type that's not highly scented to make the person feel comfortable. And then finally, one of the gifts that was given to me, and something that can be ordered from different organizations that sell these types of things. This was given to me by a dear friend, and it was bought at the Women's Alliance for Theology, Ethics, and Ritual, which is some organization down in Maryland. But again, you can get these in many different places. This happens to be seeds, and she gave this to me so that as I was getting better, I would later plant this. But of course, I loved her. I love remembering her, and so I never planted it. But it's just a nice touch, you know, and you might do something similar. You don't have to, but you got to admit, that's pretty cool. And then we're going to stick all of this stuff inside of this basket, and as soon as we do that, we'll let you see it.
Here's our completed chemotherapy care kit. Depending on your financial limitations, you could make one bigger, you could make one smaller, you can include anything that you know the person that you're thinking of would enjoy. Cancer patients and chemotherapy patients love to know that they're being thought of. Right, Mom?
That's right. That's really the most important thing. When you have something that's as challenging as a cancer diagnosis, of course you think of the worst thing that could happen. But you know what? No matter what happens, you want to know that at this time and in this place, that people love you. I mean, we hope that's what everybody wants in life, is simply to be loved. And this is just one of the ways to show people that you care, and you can do it. We know you can do it.
So, if you just follow some of our simple tips and add in some things that you know people in general, but especially your patient, likes, your basket is a no-fail winner gift. Thanks for watching.
Bye.
Bye.